Hello and welcome to myRNpodcast, the podcast dedicated to providing insight and encouragement to the nursing community. I'm your host, Devin DeBoer. Thanks for joining me. And today I had the opportunity to speak with Quinn McGill, who is a nurse with 5 years experience in the ER. We discussed how COVID has changed policies and procedures and life as an ER nurse. We also discussed the unique challenges of being an ER nurse and stressors that come along with it, which led us to a very interesting discussion on how to stay balanced and healthy with your life as an ER nurse, and then had a candid conversation of the unique skill set and things to think about before you apply to become an ER nurse. So I think you'll find it very helpful and insightful. Hope you enjoy it, and thanks for joining me. I just want to start by asking, so how did you get your start in nursing? What's your experience has been in nursing?
Sure, yeah. Just from the beginning, you mean in general, as far as okay, sure.
Mm-hmm. Yeah.
So, I was actually 19. I was at like a 5th year life crisis where I had transferred school and then I don't know what I'm gonna do type thing. And I'm, very strong in faith personally, and so I went to my dentist of all things. Actually, this is actually a bizarre story, and I'm sorry for the background noise.
No, you're good. You're good.
So I went to my dentist. She'd been cleaning my teeth my whole life, so I was filling her in on the last drama of the 6 months of my 19-year-old life. And she was like, well, Quinn, what do you like to do? All these different things. And so she goes, Quinn, I really just feel like God's telling me you should be a nurse. I was so desperate that I was like, fantastic. So I literally went to an academic advisor the next day.
Okay.
We set up a 3.5-year plan because it was through like a CC, so we had to figure out transfer, all that stuff. And then I just didn't turn back, which praise God, because I had no idea what a nurse actually did. So it was both very, very impulsive, seemingly very foolish, but I'm so thankful that it worked out.
So you signed up for a nursing program without ever checking out what nursing actually was?
No, I never really, my family members were never unhealthy, so I never, had to go to a hospital. I went to a doctor's office, so I knew that there were nurses there that did that stuff. But beyond that, I had absolutely no idea.
Wow.
So,
that's cool.
That's my story.
Yeah, that's kind of a rare situation, I think, for somebody saying, I'm going to be a nurse. I have no idea what they do, but I'm going to be a nurse.
But here we are. Yeah, no. So I'm so thankful, though. You know what I mean? It's a great career. And I know, the basic framework was I like to help people. I like people, type of a thing. So, that's how that happened.
You graduated from where then?
So I'm from Jackson, Michigan originally, Spring Arbor more specifically. So I went through the Jackson Community College program there for my associate degree. Okay. And I had originally started at Grand Valley and transferred out. So then the day I graduated, I moved to Grand Rapids. I packed up my little Subaru Forester, moved to Grand Rapids, and then started my bachelor's program at Grand Valley, the transition program, the associate for the bachelor's program. Okay. So you're able to work. The hospital paid for partial of that degree. Oh, okay. So, yeah.
What hospital was that?
That's what I'm at Metro Health Hospital.
Oh, okay.
In Wyoming, Michigan. Yep.
Are you?
In the ER down there. Yeah.
So you probably know a Dr. Hartgerich.
Oh my gosh, Todd? Yes.
Yeah.
No, he's great. Absolutely. Yeah, I work with him.
So this in 2 weeks we're going to be taking a bike trip. I don't know if he's mentioned this at all.
He bikes. I know he bikes. That's so cool. Look at
I'm one of the guys that get. Yeah. So I'm one of the guys that gets to bike along with him. So my business partner. So awesome. John went to high school with Todd. So, yeah, he's a great guy. That's awesome. So I don't know him that well. I didn't go to high school with him, but I'm going to spend a week with him.
It makes this so much more fun. You know what I mean? When you know those mutual connections. That's so cool.
Yes.
Awesome.
So currently, walk me through, what have you done so far in your nursing career?
So I started out in orthopedics at Metro. Okay. So I did that for 1 year and 8 months. I had done my leadership in my nursing school degree in ER. That's the last semester back home. And it wasn't necessarily what I expected. So I kind of let that go. But then again, I attribute it to personally God and his plan for me. Doors opened in the ER at Metro. And I was just well, I'm happy with where I'm at, but let's see what happens. And everything went wide open. So I've been in the ER now for going on 5 years. Almost.
Oh, wow. Okay.
Yeah. Yep.
Do you like that schedule of, do you guys work 312s or how do you do that?
Yes. So we do 312s for the most part. We just implemented a 410 schedule for some of our staff. So that's what I'm doing currently.
Okay.
So we're just kind of testing that out to see if.
Do you like that better?
No, I don't personally, but
okay.
we're working out kinks. So, you roll, give it a chance.
Yep.
But yeah.
So 5 years in the ER, you probably feel like you've seen not everything, but feel very comfortable in the ER then. With
Definitely.
Whatever happens.
I would say it's interesting because I would say the last 6 months is when I really feel like you come in to your role, in a new way. I've definitely sensed a shift in my thought processes, just my overall confidence in general.
Mm-hmm.
And it's really interesting. It just kind of happens naturally, which is kind of cool,
Mm-hmm.
But yeah, definitely there.
Oh, cool.
So.
It's interesting you say that because I think it takes at least, I've worked in many different settings in my career too in the healthcare as a therapist, and I think it takes at least 1.5 years for you really to start to get a grasp on it. And I think it's that hard time, that 1.5 years where you kind of know what you're doing, but you don't feel like you've mastered it. Whether it's all the pieces getting put together, it takes that long to gel, I think,
Well, you have to be patient with yourself too, because, it's easy to look around and be like, oh my gosh, these people look so comfortable, or they feel like, they walk into a room and they can just see things that I'm not even paying attention to. And I was actually talking to my manager about that idea, and she said, there's just nothing that time can make up for when it comes to a career and what you're exposed to. So yeah, I totally agree with that 100%.
I feel like school gives you're competent to not hurt anybody, but then it just gets piled on. It doesn't just give you the basics to understand and just keep your head above water, but you're not swimming yet. You're just kind of treading water and staying afloat.
100%, you're just flopping.
Right. That's right.
Totally.
So the focus of today is kind of to get a nurse's perspective. This is great from an ER perspective about COVID. And I just want to start by asking, when it first came onto the scene, walk me through that first week or two when you started treating patients. What were you feeling like? What was going through your mind?
It was very interesting. I had to really on a personal level, I had to kind of square myself up and be like, what do I think and feel about this? What do the experts say? And then you had these tensions with family members, tensions with providers even, where it was like, what are their thoughts and opinions? And it was so brand new that it was definitely the more heightened, hair on your neck situation where it's like, okay, trying to think about infection prevention, walking through every single step perfectly, and then you stop and you're like, it can't be perfect. There's just no way. There's no way to make it perfect, but what can we do to protect ourselves and people as best as possible? So what that looked like was our manager at the time, he separated our ER into 2 sections. So essentially clean versus unclean. So non-viral patients, so patients that don't have the fever, cough, shortness of breath, just the basic aspects of what the COVID virus looked like to our knowledge at that point, and then separating those from the viral patients. And then it was PPE, so gowning, masks, goggles, hair, coverings, stuff like that. Figuring out what staff should be back there. Should we put people back there that have family and kids, or me not being in that position, being single with no kids? I would much rather do that so that you have more peace of mind. I'm not taking that home to anybody else, type of a thing. So that was definitely interesting. As far as the patients themselves go, you saw, and this is coming from a very somewhat jaded ER nurse perspective, mind you, where it's like, you don't need to be here, you need to go home. You know what I mean? You had some patients that were coming in that definitely needed to be there. from an emergent standpoint, if you look at it truly emergent, but you don't get to tell somebody what they think an emergency is and what it's not. So then you have people coming in with any sniffle and they're like, I want to be tested for COVID. And it's like, no, COVID's still a virus. So even if you have it, keep your butt at home so that you're not spreading it. And then it's a virus. Like, look at it as if you were having a little bit of a cold. Then if your symptoms do become unmanageable at home and emergent, come in. And so there was that tension too, where, I mean, even people that were like single moms, they're like, do I quarantine for my kids? Well, I can't send my kids then to their grandparents' house. Just those crazy dynamics that you're encountering and trying to be empathetic to. It's like, it was so massive. I mean, it was global. It is global. To where it's trying to wrap your head around that, not only on a personal level, not only on a facility-based level with Metro and then the ER specifically as a unit, but then also like trying to wrap your head around what this looks like for the average Joe and Jane. You know what I mean? That you're dealing with coming in.
Right.
So yeah, it's really surreal to like think about.
It's very humbling to hear you say, I'm willing to be on the front lines more so than another coworker because I'm single. I don't have a family member. But how are you feeling about catching it or getting it or contracting it?
Oh, to be honest, and like, please understand that I do not mean this like flippantly in any way. But what is going to this is how I function in life. I work in an emergency room. So I'm going to see if we have a pandemic or if there is something as crazy as like chemical warfare, if you will, whether it's like civil terrorism, that type of a thing. Like, that you are going to be the first one to encounter it outside of the actual person that experienced it. So it's like secondary exposure, right? So for me, to be honest and quite frank, I just planned on getting it. Like, again, I don't mean to sound flippant, but it's like, no, I have to plan on getting it. I'm going to do my best to protect myself and my patients. But if I think in my head that I'm not going to get it, that's just not realistic with what you do. It's just not. And so on it, like 100% disclosure, I honestly just planned on getting it. And then best case scenario, I didn't. Like, it is what it is. You know?
Well, I think it's a very healthy perspective, and you probably don't have any underlying health symptoms that would make you a high-risk patient then, right?
No. Well, I have some asthma, but I mean, it's very much like sports-induced type thing.
Okay.
So it's not like the reactive airway disease that can be spontaneous or anything like that.
Yeah, sure. Okay.
Yeah.
Do you think, stepping back from your own personal perspective, and I'm not asking about Metro Health in general or specifically.
Oh, that's okay. I appreciate that.
How do you think the public health system did on informing the public on who should get help, when should you get help? And as a follow-up, what do you think we should do differently if another thing like this comes around?
Sure. I think we did the best we could. You know what I mean? Like, as far as looking at the examples that we saw from Italy and then traveling to, New York City and then areas of Asia, you're seeing firsthand how fast it can spread. But the truth of the matter is like, it's so brand new. It's so brand new. And so when you're seeing it spread as fast as it is, and then the symptoms become as severe as quickly as they do, what else are you supposed to do? You know what I mean? And so you had a lot of perspectives from like, well, they're just inflicting fear. It's like, well, fear is a healthy thing when placed in the right arena, and then, protecting other people, fine. And then the battle of personal responsibility. Why can't people just choose what's going to be best for them? Well, then how do you manage that when what they're doing is putting other people at risk? Like, there are so many layers to it that it was almost like you have to put out the extreme to the public just to express the severity of it and the weightiness of it and to take it seriously, especially with it being brand new to our world. So I think they did a good job. I think the problem is when people take information and everybody's receiving it in different ways. and then they're filtering it through different things. So to them, me being somewhat short of breath because I have a cold means that I have COVID. I need to go get help, but they come in and their oxygen saturation is at 100%. You know what I mean?
Yeah.
So it's like, I don't know if that's the avenue you were going down.
Yep. No, exactly. Yep.
But it was definitely, I think they did the best that they could. And then there's also other factors that you can't control as far as government, regulation, standards. You're hearing stuff from the CDC. You're getting all of these different things. And there's always that question, especially in our culture today, of like, who's right and who's to trust. And then you're going to create polarities. And that's what we've seen. Yeah. So, yeah, as far as in a nutshell, I think they did the best that they could. Moving forward, I mean, hopefully we don't see another brand new thing like this for another 100 years. I don't know.
Yeah.
But what's the data going to come from it? Is the data valid? There's all the questions. And I've thought about all the things, as I'm sure everybody has, in their own realm of expertise. But, yeah. I think they did what they could.
Yeah, I don't think healthcare is going to be the same ever.
No. Yeah. And I don't know if I like it or hate it or if it's both, but it is what it is,
Yeah.
So
now, boots on the ground perspective, did you see a commonality of presentation of COVID from patients? You're like, somebody walks in the door and you're taking vitals and all this stuff. You're like, boom, they got it. Or no, they don't have it.
Oh, no, there's no way. That's why you had to kind of clump them in viral versus non-viral, right?
Okay.
Same with the flu. Like, you have somebody walking in with flu-like symptoms, you test them, not everybody has the flu. They might have some sort of rhinovirus or something else that can show up in the different cultures and tests that we do. You could be suspecting, but it was more so just kind of like, okay, are you a young person that was able to contract it for whatever reason? Or are you a person with COPD and other lung issues that then developed into the coronavirus itself? We had people coming in. I had a few patients coming in. They were like, I haven't left my house in 9 weeks. How did I get it? I don't know how to answer that question. You know what I mean? Like, I can't answer that. And again, that just comes back to it being so brand new. All of the information's changing constantly. You have one study coming out, and then the next week there's another study stating that it's debunking the first study. So it's just, what do you do? And I think that's what is so hard as a healthcare worker, is feeling helpless for yourself even. So then when people are coming to you asking questions, it's like, and maybe sounds terrible, but it's true. I got to this point where I had allowed myself not to have an opinion because I don't have the facts. So I'm going to do what I can. I don't think anybody has the facts unless you're an epidemiologist working specifically with the coronavirus itself. Where are the facts coming from? And so again, that's where it's tough, and it can sound really flippant and irresponsible, but it was just, I had to come to this place in my life where it was like, I need to allow myself not to have an opinion, but do my best to protect myself and other people. Because right now, opinions aren't going to change the trajectory of anything. That's what I think personally.
Yeah.
So, yeah.
Huh. And so, was there a pattern of, did you see healthy people that had no underlying comorbidities get it severely, and those that did have underlying comorbidities get it severely, both on equal numbers?
Oh, I don't know if I would say equal necessarily. This has also been so spread out now that it's hard to differentiate. Okay. I mean, but I've definitely had people that no comorbidities, young people coming in. Some of them just get the mild symptoms, and then we've had some really sick people. They're also finding that young people are having strokes from this thing. It's affecting the clotting factors and different things along those lines, physiologically. But definitely, I would say definitely more predominant in the immunocompromised and older population.
Okay.
But I can't necessarily weigh, what the fraction or percentage would have been.
Okay. Just curious.
Yeah.
Because they were just saying it's overwhelmingly people that are immunocompromised or do have significant comorbidities are much higher risk. So I didn't know if you were seeing that on the ground at all.
Absolutely. Yeah. And you're going to see that again with any type of viral season. You know what I mean? You're going to see more of the immunocompromised population come in. So yeah, to answer your question ultimately on that end of the spectrum, yeah, definitely more people are going to come in that are in that category.
Okay.
For sure.
And in your opinion, what should the average person do right now with the information that we do have out in the public, out and living their normal everyday life? Should we be masking? Should we be social distancing? Masking indoors?
Yeah.
What are you telling your patients?
Oh, as far as what I'm telling my patients, when I'm at the hospital, I tell my patients to follow CDC guidelines and to mask when you're in stores and, whatever the other establishments are doing, especially if they're symptomatic. So that's the key is like, if they're symptomatic, yes, you need to be wearing a mask if you're not going to be quarantining yourself for sure. Ultimately, you should be quarantining yourself and staying away just like if you were sick any other time, right? Unsymptomatic or non-symptomatic, they stay to stay 6 feet away. My thought process with that is if you are asymptomatic and you are keeping that distance, especially with immunocompromised people, why would you necessarily need a mask? You know what I mean? Mm-hmm. But again, that's where it goes back to what I said about not having an opinion because there's so much unknown. So at this point, for me, being a healthcare worker, I'm 100% exposed. You know what I mean? My personal practice lately, now that it's been further down the road, I haven't been symptomatic, and that could change. I'm not trying to act like that couldn't.
Right. Yeah.
Is I tell people if they do want to see me and spend time together, I tell them I am still being exposed to COVID patients here and there. I wouldn't say every day, to my knowledge. So if you are comfortable with that, we can spend time together. It's outside, whatever that looks like. Some people would cringe when I say that. But at the same time, this virus isn't going anywhere. And so at what point do we go back to normal life? Of course, we're going to see spikes. Of course we are. And so it's like, again, that goes back to that unknown. We want to know what the right thing to do is. And we're never going to know that. We're just going to do our best. And so that's kind of where I stand. I don't know if that.
Yeah, that's my question.
Your questions or not. Yeah. So.
How was it not having family in the ER? How was that from a nursing perspective? How much more challenge did it provide you guys?
It was both the best thing in the world and the worst thing in the world. To be honest.
Really?
So one of the nice aspects of it from a more, and this is me just being transparent, from a more selfish perspective, it's nice not having that family dynamic where I can just focus on my patient. I can look at them. I can, as a nurse, you're wearing so many hats. So I'm looking at my patient, caring for my patient. You're also seeing how it's affecting the family. So you're trying to keep them informed, trying to provide support for them. And to be honest, like sometimes you get great family, sometimes you get terrible family. And they can just be very hovering, understandably so, especially in an emergent situation. But as a healthcare provider, that just adds an added layer of stress to an already stressful situation. So from that perspective, it was so nice where it's like, I'm not having to deal with that extra stare, that extra question, all of that. I can take care of the patient. And then in my time frame, I can then update them over the phone, which is where the challenges come in, right?
Okay.
You also see the strain on the patient, which is what kills you. So that's the worst part, right? Okay. I had a patient come in, very obvious stroke. It was a legit stroke, and his family couldn't be there. And that was that's horrifying for him. You know what I mean? And that's horrifying for the family. So trying to figure out how do I build that bridge for them as much as possible without them actually physically being able to be there was almost just as stressful. So it's just kind of, it was really hard. It was really hard to see how it affected the patient and the family member, but also, again, the positives from the nursing practice standpoint of being able to focus and really hone in on the patient themselves was the positive part of it. So,
wow.
Yeah.
How has it been in your kind of social circles? Have you seen a kind of return to normal where you're getting back with friends? But I mean, it severely restricted you initially, right? To how much you actually could talk with people because you might be exposing them or getting together with people.
Yeah.
What was your experience?
In the beginning, I was only hanging out with coworkers. Thought process is at that point we've all been exposed, so I feel comfortable hanging out with them. You have to have social interaction. It's a human need, whatever that looks like. So with my family, it was more so just FaceTime calls. I FaceTimed, every day, multiple times a day.
Oh, really?
Sometimes.
Okay.
And then with friends, it was just coworkers for the longest time for me.
Okay.
And then over time, again, you be respectful of other people's feelings and thoughts and boundaries within the dynamic. And then people know what I do. And so it's just kind of like, are you comfortable? If people were welcoming me into their homes, are you comfortable? And so I think some people would even hear that coming from an ERner's perspective and be like, well, you should know better than that. And I see that. But for me personally, it's just kind of like, that's where the personal responsibility piece comes in, where it's, I have divulged to you that I'm still seeing this. I can't sit here and blame myself if it's a virus. Like if you go to the grocery store, you can get it.
Yeah.
So that's where it's just, there's definitely lines of wisdom to follow, but then there's also just practical human need and social structuring that has to take place and get back to normal. So it's definitely been a lot more loose on my end as far as social interaction.
Well, I think you handled it responsibly. You informed people, but you also didn't see them when you had a fever or when you had a cough or anything like that. It was I'm doing all the precautions that I can, but I'm a human. I have to have interaction with people. Yeah.
Yep. Absolutely.
In your personal opinion, what do you think is going to happen in the fall?
Oh gosh. I don't know.
Okay.
I think we're going to see a spike.
Okay.
You're going to see, we're entering into flu season in October. There's going to be a spike. That's just how it's going to go. Again, the virus isn't leaving the earth.
Yeah.
Hopefully it doesn't overwhelm our health system. Don't know.
What is your health system thinking about and preparing again for an eventuality? Or
I'm not seeing that happen. If anything, we've gotten rid of some of the parameters that we had that were more strict early on. It's also a regional thing too. We're not New York City. People aren't piled on top of each other. So that's going to look a lot different. But no, I haven't seen them doing anything to implement a possible surge in a couple of months or anything along those lines.
Well, do you think the first one didn't overwhelm the health system. Do you think it'll overwhelm it in the fall? Is that?
I don't know. I don't know what to think. Like, that's the honest answer is, like, you hear, even with our attending providers, our attending physicians, you hear some of them that are terrified for it. And then you hear some of them that are like, no, like, I don't think we're going to get one. And I think that's what creates that personal tension of who do you listen to? Who's right? Who's wrong? These are the experts. But, like, where's their information coming from? Is that even valid? I don't know.
Wow.
And honestly, I don't think anybody really knows. That's the scary part is we want to know.
Yeah.
But you're just going to have to take it in stride.
I think we're all tired of, I don't know. I don't know. Because I think a known problem or a known mountain or a valley, whatever you want to call it, is much more easily to handle than an unknown. It's just like, oh my gosh, how do you handle an unknown? It's so hard. Mentally.
I agree, but I also think that there's also a level of freedom in that too. Because that's when you we're such a control freak culture right now. Like, no, I'm just being honest. Like, I am. Like, I'm not even going to act like I'm not. I am. But then there's this beautiful underlying reverence that you have to have for the fact that you don't get to control life. Nobody knew that this virus was coming. True. Nobody here anyways. You know what I mean? Like, at least we don't think so. There's all the conspiracy theories out there, whatever. But, like, it just is what it is. And so it's like, how do you make lemon lemonade out of some lemons with the unknown and just roll with it.
Yep.
And deal with it a day at a time. Like, it's hard, but it's a discipline like anything else, I think.
I agree that we as a society, and I'm included in that, try to control all the stuff. You know, I have, particularly when I look at my kids, it's like you want to like put a hedge around them, bubble wrap them, send them out the door, you know.
Totally.
But you can't do that.
No.
And they're going to be worse for it, you know, if you
Props
do that.
to you for being a parent, because I don't know how you guys do it. I can't imagine.
I'm kind of lucky because my youngest is he's a freshman in college, so I'm good. So
yeah, they're out of the nest right now.
They're kind of responsible for themselves. So
yeah, that's crazy. But yeah, no, it is what it is, and it's not what it's not. And so
correct. Yes. Yeah.
Gotta go with it.
Oh. So moving forward, spike or no spike in the fall, you're like, you know what? We're gonna be able to handle it, or it might overwhelm us a little bit, but I'm not worried about it.
No, I'm not. I think if we do get a spike in the fall, the first wave of preparation that we did do was like a test run. So it's like implementing those things again is going to be a lot easier than when they were brand new, you know. Cool. Both in the hospital and outside of the hospital and your daily life, you know, it's just kind of like, okay, like we prepared for the worst. It didn't happen. If it does happen, you'll prepare the same way, and then even then that's going to morph and evolve, and so you'll have to adjust as it comes, you know. Okay. That's ER for you, though. The ER world is all about you have no idea what's coming through that door. You're going to adjust accordingly. So that's just how it goes.
No day's the same, I bet, huh?
No. No. That's, again, both the worst and the best part of working in the ER, but, you know.
Yeah. I always like to end on a couple of reflection type questions.
Sure.
So you've been a nurse 6.5 years now, correct? Year and a half in orthopedics. You've been a nurse 6.5 years, 5 in ER and year and a half in orthopedics. Let's say you meet somebody who is you 6 years ago. Would you tell them to go into nursing? What would you say?
Oh, man. I would tell them that it's a great career.
Okay.
But I would prepare them for the frustrations that it brings.
Okay.
As far as regulations, charting, all of the different administrative things that come with it that can take away from the nursing practice itself that has even gotten worse since I started.
What's great about it? You started with, it's a great career. What makes it a great career?
It's flexible. I mean, the flexibility especially as a single female, you can come out of school and really support yourself well and rather comfortably, you know, materially wise. There's so much movement that you can do up, down, lateral, as far as the realm of nursing you want to do. You can go into marketing as a nurse. You can go into IT as a nurse within charting systems. You know, you can really morph into a different person within the career itself, which is really cool.
Yeah.
Yeah.
I
would say yes. Sorry.
Do it.
I never give one-worded answers.
No, that's good. It's a really boring podcast. We just give one-word answers. So I appreciate that. So in a nutshell, yes, but realize it's not all just this great career being able to just take care of patients. You have these other tasks. And I would say the exact same thing if somebody wants to go into therapy. I mean, the best part is watching somebody, helping somebody, enabling them to meet their goals, or whatever that might be. And then, but you also got to document. You also got to deal with coworkers. You administration. You got to deal with productivity. You got to deal with all this stuff.
Politics, all the things.
Yes, politics. I wish we could get rid of politics. Just wow.
I am right there.
That's another podcast. But so my next reflection question is, take that same idea and say, would you recommend being an ER nurse?
Yes.
Okay.
But you need to have a threshold for stress. You need to have a threshold for coping. It takes a very specific personality to do ER nursing.
Who would that? What? Give me some characteristics of people that would be good ER nurses.
People who are able to keep their cool in life-threatening situations.
Okay.
People who are able to. You need to be able to feel. You can't just be numb all the time, and that's a battle that I think every ER nurse will tell you they fight. But you need to be able to, once you do start feeling those emotions, appropriately, literally shut them down immediately so that your judgment can be very objective.
Okay.
You would need to be able to be flexible. You need to be able to multitask. You have to be able to communicate clearly, directly, and be able to handle personalities. Your interpersonal collaboration's huge in ER.
Wow.
And you have to be willing to go above the threshold of stress that you thought you can handle and deal with it in the moment, and then go back and cope with it later.
Wow.
Because you don't get to. It's just funny. You feel. I know. Here's an example. Like, I'm in a busy day. I'm feeling the stress, like physically feeling it, mentally and emotionally. But then things literally get so out of control. It's almost like you went above your threshold to where now everything leveled back out because you go into survival mode of what is truly most critical and most important, which is a beautiful thing. But then the weight that causes in that process that you don't even realize happened, then comes back later. So you have to, I haven't figured it all out yet. Maybe one day I will, but you have to really be able to live with that.
Wow. Sounds like a very special person to be able to handle all those things, because it sounds like it's just got that stress level is a little higher in the ER. You can't walk out of the room because you need to handle the situation right there.
You can't quit.
No, you can't. You have to be there. You have to finish it. Whereas if you're an other nurse, if somebody's blowing up, you could walk out of the room because it's not an immediate need.
Right. It's not within your scope, right? So it's like if you're not the expert on an emergent thing, the best thing for you to do for yourself and the person is to walk away and find help for people that do. When you are that person, you don't get to quit. I might not know everything, and I might need somebody else to come into the room, but I still have to learn because Lord knows it's not going to be the last time I see it. So I don't get to walk away, even if I'm not the person that has the best ability to deal with the situation.
Wow. And you have to communicate effectively to the patient and also your PAs, your nurse practitioners, and your MDs. You have to, you're in the middle, right?
And the hard part is when, you have to be in the middle. The hard part in that dynamic is when you're in a truly life or death emergent situation. The family is now secondary and even tertiary to, I need to be communicating with my coworkers, my doctor, and my staff, and that can really make people frustrated and upset. And so as the nurse, you have to take that on too. While knowing that they don't understand that what you're actually doing isn't neglecting them, it's actually putting them first. They just don't understand or get that. So it's definitely, you need a lot of grace.
Yeah, and I like that idea too of you having, you can't not feel, because you have to be sympathetic, but you cannot be empathetic, because then it clouds judgment. It's like, in my experience, it's like, I can't go through I have to acknowledge and empathize with the patient's pain that they're going through, like they had a pelvic fracture, multiple contusions on their right thigh, but they got to get out of bed, right? It's like, well, we got to get out of bed, and you know what? It's going to be painful. We're going to work together. We're going to try to do this at a speed and a pace that you can handle, but I know it's going to hurt, but we got to get this done. It's like, but you can't take that on 10 times a day, that emotion, because you'll burn out.
I mean, this might this might sound completely horrifically like inhumane, but in the ER, because of the requirements that we have to fulfill, you almost can't even let yourself feel the sympathy aspect depending on what day you're on. To be honest, like you have to get in, like, if I'm on day 3 and it's been a whirlwind, I'm exhausted. And so for me to be able to do my job well and fulfill my duties, sometimes, and this is what is the hardest part, is sometimes I have to give myself permission not to be sympathetic. That doesn't mean that I give myself permission to be a jerk or, you know what I mean? But there are some days I give myself permission not to be as talkative with my patients, not to be, and I have to let myself do that for me. And again, I even deal with that. Like, is that selfish? Does that mean I need to change careers, or does that mean, I don't know? But yeah, like that emotional connection with the people that you deal with is completely different from any other realm of nursing. I'm convinced.
Wow. And how do you take care of yourself with all that stress, all that? What do you do to maintain sanity?
To be honest, I don't do the best job of it personally. It's hard to do. Your energy levels fluctuate, but for me, a lot of it is just spending time with people that are easy. Like, that sounds weird, but like, I spend time with easy people, because then I can engage in that relationship and that communication with people I really care about, that I really love, that know me and that I know intimately. Exercise is definitely huge. That fluctuates too, just in life, whatever. And then routines. So like, when I come home, I have my show that I watch a few episodes of, and that's my way to wind down. I'll read a book some nights if I'm not feeling it. It just looks different day to day. Some days you walk out and it's not a big deal, but then other days, you know, just is like, what just happened?
Yeah. And then you add the level of stress that COVID has on top of that, and you're like, it just adds another layer, like you said.
Totally. And not even just medically, socially, all of the different aspects that have come with COVID. I can't wait when COVID's not in our vocabulary for a while. Like, that'll be so nice.
What are the physicians saying with regards to a vaccine that you've heard lately? Or is it still like next spring, next summer?
To be honest, I haven't heard anything. I mean, that hasn't really been a conversation going around personally in my ER. But again, and I hate to make it to go this way, but it just is what it is. You don't know what's accurate and what's not anymore. So even if you're watching the news report, and that's changing constantly. So that's going to be up to the epidemiologists and then the politicians moving forward, what's going to happen with that. But I haven't personally heard anything specific as far as the time frame goes.
Well, I thank you so much for this gift of time.
Absolutely.
It's fantastic.
Totally. This has been fun.
Well, thanks again, Quinn. Appreciate it so much.
Absolutely.
This is so
cool. It was so good to meet you and chat.
Yeah, good to meet you. Well, take care.
Awesome. You too,
Thank you very much.
I appreciate
it. Yep, bye-bye.
Yeah.